Hi, my name is Portia Cates, and I am doing my persuasive speech on lung cancer and what can cause it and ways to decrease chances of getting lung cancer. Why I'm talking about lung cancer is because I lost my mom almost a year ago. Starting March 1st, it will be a year to lung cancer. We never made it to treatment due to other illnesses that were happening in between her getting treatment or trying to get stronger to receive chemotherapy. But of course, we all know lung cancer can come from smoking cigarettes, of course. Another way lung cancer can come, you can contract lung cancer. I won't say contract, but you can be diagnosed with lung cancer is from secondhand smoke. It can be from air pollution. It can be from things such as your work environment, as well as having it run in your family. So it can be genetic as well. So sometimes, genetics, you can't beat genetics a lot of times, but you can at least decrease the risk by trying to do whatever it is that you can to prevent it. With my mom, she smoked for a long time. That's what always had me to feel like I don't want to smoke. For one, it stinks. And for two, I just don't like the cough that she had. I don't like the smell of it. But again, she was 78 years old when she passed last year. And so it can take people much longer to uh, be diagnosed with lung cancer because it can start small and then it can start growing slowly. So that's another thing with lung cancer as well. Also, there are two main types of lung cancer. One is small cell lung cancer, which is small and it can be detected. It grows slowly. It grows really slowly. And by the time that you catch it, it can be widespread. And then we have non small cell lung cancer, which with non small cell lung cancer, um, there are different types and they have to be seen. The cells have to be looked at under a microscope. So that's another thing because there are different types of non small cell. We have adrenocarcinomas, non-small lung cell, and we have squamous cell carcinoma. It's just so many ones, but there's a small group, but different mutations and types of lung cancer. Also, uh, to if you are a smoker, suggestion is to get your lung cancer screening. Um, I'll say between the ages of 50 years old, starting at 50 years old, and it could be um, you can get a lung cancer screening sooner than that if you've been smoking well on before your 20s. Some people start in their teens, but you can get your lung cancer screening depending on, you may have to pay out of pocket if insurance doesn't pay for it. So that's another thing. And you may not qualify as well at a certain age, and you have to have smoked, I think, a certain amount of cigarettes packs per day to be considered for the lung screening. But sometimes lung cancer can be detected through a CT scan as well as a PET scan. Um, Chest X-rays, they can't detect it, but they can see something. Your provider can see something suspicious in the chest X-ray. Which with my mom, she was having issues, feeling like she was the provider um said that she had pneumonia, which they gave her antibiotic for. And she still continued to have the cough and the wheezing. And I would ask my mother, hey, you still having that cough? And she'd be like, yeah, it's getting worse. And I would go and check her oxygen. Her oxygen is fine, but I can still hear the wheezing. And I can hear, that she's having some shortness of breath. So what I decided to do is get her to go to the ED, which that's when they discovered the mass on her lungs when she got a CT scan done, because she was having swelling in her face, which is called um, SVC syndrome. And with this, it's actually, they call it that, it's supavena cava syndrome. So, superior vena cava syndrome, which means that the tumor was pressing on all her arteries, main veins and arteries, in her chest, causing swelling in her upper extremities, face, and your face would swell like a block. And once that tumor um has shrunk, then that's when your the swelling and everything will go down. And that's what was the issue with my mother, which she did have radiation treatment, but she was not strong enough to get chemotherapy at the time. But also, going back, and like I said, you can have a biopsy done, you can have a CT scan done, you can have a PET scan done. And with the biopsy, they will test it and basically will say what stage it is, what type of cancer it is, and that right there will determine the treatment that you can get for lung cancer. And there are certain treatments that you can get, which one could be immunotherapy, which is not as harsh as chemotherapy. And then we have other chemotherapies that are very harsh, and some people are not strong enough to have the chemotherapy, but yet and still they still will try it, just so they can better their chances of living longer. um it can be, you can have a chemo peel, which sometimes it could work and other times it will stop working because it's not as strong, or maybe the side effects are just as worse as the chemotherapy. But to prolong your life, you can get immunotherapy, which is not as harsh, and people still live longer and be able to maintain until the cancer gets out of control. Immunotherapy you can get once a month, depending on your provider. And with chemotherapy, you might get it, depending on how strong it is, you may get it every 2 to 3 weeks. It just depends on um, the stage of your cancer, and also if it's curable. And most times it's not curable. And they just do chemotherapy for maintenance, just to help keep the tumor at bay. And sometimes you can have surgery to remove a certain tumor, just depending on where it is. And other times it's too dangerous to even have the um, tumor removed, because it's a higher risk of you bleeding and not surviving the surgery. Also, uh, just signs of symptoms of um, lung cancer. You can have wheezing, hoarseness, shortness of breath, chest pain, weight loss, unexplained weight loss. So it's just a lot of things that come into play with lung cancer. So my advice to you and anybody else that smokes: try to either uh, decrease your smoking, seek help, get uh, what do you call those pads? Cigarette, nicotine patches. Sorry, get nicotine patches. Talk to your provider. See what can be provided for you so that it can lessen your chances of getting lung cancer. Thank you.